I do think that using wearables to track your movement, your physical activity, maybe your vital signs like your heart rate, your breathing rate, how much you're sleeping, all of that can be very useful if you as the patient can funnel that information in a positive way. You might be confused as to which bits of this information are most helpful. So I think that's where it's really useful to share it with your doctor and say, okay, how does this fit into my overall picture? How does this fit into my medical problems or ones that I might have in the future? How does this fit together with maybe some of the blood work I've had, some of the vital signs you've taken in the office, maybe my weight, maybe my diet? And I think the most useful part of wearables that we can use as primary care physicians is to take the data, see how it applies to you, see where you're most engaged. What are your goals? What do you really want to improve upon? And is it weight? Is it physical activity, exercise? Is it sleep? Is it stress? And I think with each of those, we can't certainly go over all of those at one visit, but we can, break them apart, prioritize together where I can coach you and say, all right, this kind of information is really useful. This information is just more noise, not as much signal. And let's together come up with a short-term plan, a medium-term plan, and then a long-term plan to make you healthier using all this data. What I don't love about the wearables is that often it creates a lot of unnecessary anxiety that wasn't there beforehand, before you had all this data that to your mind makes you think, I'm unhealthy. Why is my heart rate so high? Or why is there so much variability? Is there something wrong with me? The last thing I want to do, the last thing that any physician wants to do is to add one more stressor to your life in this otherwise very stressful world. And so I think that it's a slippery slope sometimes, depending on who's using the wearable and what kind of sort of emotional state they're in, or what they're sort of potentially prone for in terms of anxiety and stress. And so it can be a potentially worrying item to have this thing that's constantly keeping track of all this data for you, for which you think it's helpful, but maybe it's creating more stress. I absolutely think there's some real simple steps, steps being maybe the most operative word there. A lot of people don't take enough steps. A lot of people sit at their desk all day working. And the nudges that we need might come from our wearable. We might get a notification to get up 5 minutes out of every 30 and just walk around. I'm not asking people to go out and run a marathon. I'm asking them to get up off of their butt and walk around for 5 minutes, and maybe do that every half an hour. And so there are nudges. And I think this is where the real value of a wearable is. Can a wearable actually be your behavioral nudge? Can that notification really change your behavior regularly and daily? We can use the trends that we see. I'm not asking, again, for miracles in a week or two, but you might say, or I might say to my patient, what's your baseline? You have this watch on and you've never paid attention to how many steps you take a day, or how many steps you take in the morning versus the evening. Let's make some short-term goals. Let's improve those metrics that are sort of simple to follow, simple to act upon, and see if that makes any difference with your blood pressure, makes any difference with your stress level, makes any difference with your weight. There are data that you can input for food, and calories and nutrition. And so the sky's the limit. But again, at the same time, we want to make sure that we don't bring in so much data that you're overwhelmed, or that it makes you so stressed out that you want to just drop everything and not do anything. It's like paralysis by analysis. We don't want that, but we want to sort of hone in on what small interventions can we make that'll make you healthier. Maybe you'll start eating better, maybe you'll start walking more, maybe you'll start going to sleep earlier, maybe you'll put your phone down, ironically, even because we're talking about wearables, earlier so that you get a better night's sleep. Maybe you'll want to check in with your doctor more frequently because you're getting some data about your heart rate, or potentially you find out about your blood pressure at your doctor's office and you think there's a correlation with weight, and you use some of that information to say, I'm going to become more active, check my blood pressure at home. I can email a bunch of my blood pressures to my doctor. So there's all kinds of what we call asynchronous care that can happen now with your doctor, where you may only be seeing your doctor several times a year, but you can send them data all year long. Now, some doctors won't want to hear that, but there are ways, hopefully, that we can collate the data and make it smart, or maybe in the future, artificial intelligence or machine learning can work with our medical charts and put this data together in a way that's digestible by the patient and by the doctor to make actionable changes.